السلام عليكم ورحمة الله تعالى وبركاته أطباء المستقبل، إن شاء الله تكونوا لاباس وبصحة جيدة. In this video we're gonna represent this bone called the clavicle, but we're not gonna really dive into so much details. We're gonna talk about it briefly just so that you can get what's the most important. So the clavicle, hold up a second. The clavicle, also known as the collarbone, it's not a straight bone. ما عندهاش شكل مستقيم. It is S-shaped, as you can see. It is curvy. It has an S shape. You can easily feel it right under your skin at the neck base. تحت رقبتكم تحطوا يدكم تقدروا تحسوا بيها. It connects your arm to the rest of your body. Look. So as we were saying, it connects all our body to our upper limb. As you can see, it is horizontal in the body. It's not vertical. It sits right between your shoulder blade and chest bone, which is called the sternum. Exactly this part of the sternum, which is called the manubrium. All of this is the sternum. This is the manubrium, okay? And this is the shaft of the sternum, and this is the xiphoid process, which doesn't really matter to us. So clavicle sits right between these two parts. Look. So the main parts of the clavicle are the shaft. This is the shaft. It has a body, the shaft, and two ends. One is lateral and one is medial. This is the lateral end, which is called the acromial end, and this is the sternal end, or we call it the medial end. The clavicle shaft is divided into thirds. مقسم إلى ثلاث. For why is it divided like that? Just for easy thinking. For example, مثلا يكون عندي الريبير اناتوميك هكا في الشافت هذا. باش تسهل لي نقول بالراهو مثلا نقولها في الثلث الاول. It's in the first third, like the medial third or the lateral third, etc. The outer third here is flat. Just so you can notice, it is flat and squished. جاي مسطح هذا الثلث. Meanwhile, the two medial thirds are more rounded. جايين مدورين. They're not as flat as the first one. They are more rounded, which means we can call them cylindrical, kind of S-shaped. Yeah, now let's talk about the two ends. Let's start with the lateral end, the acromial end. It is kind of flat, مسطحة, and oval shaped. It connects to the scapula, the shoulder blade, for smooth shoulder movements. Meanwhile, for the medial end or the sternal end, it is kind of bigger. It's bigger than this end, this acromial end, and it's sort of triangular, links up to the sternum. We said that it's the chest bone and even touches the first ribs cartilage الضلع الأول. On the top side, on the front, to be more precise, here attaches this muscle, which is called the deltoid muscle, which is the rounded shoulder muscle that covers the top of our shoulder. It lifts the arm to the side, forward and backward. Also on the top side, on the back, there attaches another muscle, which is called the trapezius, the big muscle, large one on the upper back and the neck. Kind of helps you shrug your shoulder, pull them back. It kind of, interfere when you move your head, etc. So this is for the upper side. We're gonna hide those. Meanwhile, lower side, or the bottom side or the inferior side, which is kind of rougher, زي أقصى, it's not as smooth as the superior one, with ridges for more attachments, like the conoid tubercle and the trapezoid line. هذو دي ريبير اناتوميك نحفظوهم هكا باليوم كاينين في the inferior side. They will allow other attachments for muscles. So yeah, the front attachments, as we already mentioned them, the deltoid, here it is, the pectoralis major muscles, the pectoralis, here they are, hold up, Pectoralis is the big chest muscle, as you can see. It helps you push things away, like when you're trying to do some push-ups. It brings your arms across your body, like when you're trying to, do the hug motion extra. For the back attachments, we've got the sternohyoid. We've also got the subclavius. We've also got the sternocleidomastoid. Here it is. It's like the long muscle from behind the ear down to our neck or chest. The collarbone, it turns your head side to side. It helps you tilt. It helps you nod your head, etc. And that's pretty much it for the clavicle. Thanks for your attention. See you in the next video.